Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.
You're watching Conversations with Jennylyn, and as I continue my COVID-19 World Interview Series, I have a very beautiful woman to share with you tonight. And she is in Singapore, and her name is Sindu Sreebhavan. And she is a consultant, an author, a speaker on innovation and growth. And I don't want to spend the 30 minutes telling you about all of her accomplishments and expertise. So I will leave it there and introduce her, and then she can tell us some more about what she does. Sindu, thank you so much for taking time out of your morning, which is evening here for me, to do this with me. Welcome to Conversations with Jennylyn.
Thank you, Jenny, and it's wonderful to be here and wonderful to be on your show. And yes, the time zones are different, but still we are talking, which is fantastic.
Isn't it amazing? Between the technology that we have today, time really doesn't matter that much if you're willing to get up or stay up.
That's true, yeah.
I've been getting up sometimes at 3 and 4 in the morning so that I can do some of these interviews, and I try really hard not to scare my guests. So tell us, what is it like in Singapore for you right now?
Singapore is a city-state. It's a very small country. It's in Asia. And at the same time, it's a financial hub. There are people of different ethnicities, who are locals here. And at the same time, there are people from all around the world who are here to work or to do their business and so on. So it's the population density is really high. But what helps here is the planning. We have gone through the times of SARS years ago. So
good.
Yeah, and and people became aware about epidemic and all these flus and diseases that spread, and people as well as the government. They have been, they were aware, but the best thing is government planned a lot of things after that, anticipating, if there is another epidemic, what are we going to do? So when we started hearing about, in the beginning of the year, when we started hearing about coronavirus in China, there were a lot of measures were already in place here, because we know that this is a country where millions of people come, although it's a small country, come and go. Here we have an apartment system, flat system. Most of the people live in apartments rather than in independent houses. So it's extremely easy to spread. So the social distancing measures were in place. So things were going good. Initially it was people who were coming from China. And the government was able to, track them, do fantastic contact tracing and bring the numbers down. But what happened after that is coronavirus picked up in the Europe. And then people who were coming from the Europe
brought it here.
It's it was kind of a second wave. And that was also, that's also contained. But then the next thing is the laborers, foreign laborers. So they live in dormitories. And that's what the government is trying to contain now, because if one person gets in a dormitory, it's easy to spread. So in the community, and the dormitories are isolated now, they are not, we don't call it lockdown here, we call it a circuit breaker here. Yeah. The circuit breaker was supposed to be until today or yesterday, but that was extended till 1st of June. And what the government also did was for the schools in Singapore, the school year is from January to December, with the holiday starting in the middle of November. So there is a mid-year holiday, that's the month of June. They brought that holiday forward. So Yeah, currently it's the holidays now. So May is the holiday period, school holiday.
Oh,
And then they will go back to school in June. So it's,
that's
you know,
pretty smart.
yeah, that is smart, because you have to make sure that there is minimum disruption, right? So we are, and we are kind of a law abiding citizens here. So whatever we hear, as long as it makes sense, and we
Yes,
don't hear, we hear only things that make sense from the leaders.
right,
So
exactly.
people do tend to appreciate and understand where it comes from, and try to follow the rules, which actually helps in not spreading the virus further, because if it goes into community, it's going to be a disaster. So if you look at the numbers nowadays, it's like 10 or less than 15 in the community. But there are a lot of people from the laborers dormitory, immigrant workers dormitory that comes. So a lot of things are going on, and but the fatality rate is very, very small. We have like 18,000 odd cases in total since the beginning, and it's unfortunate, but there were only 18 fatalities, and most of them are people over 70, and so on. So the fatality rate is very, very small here, which is good, which also shows that people are being careful. But what I see, not just in Singapore but around the world, is the anxiety among people. Initially, it was just about the virus, just about how to make sure that everything works, whether I'll get enough toilet papers and so on. But now it's different. After the first 2 weeks, it's totally different. People are worried about their businesses. People are worried about their jobs. A lot of people are losing their jobs, and so it's around 4 million, or a huge number of jobs are going to be at stake. So it's the anxiety, it's the emotional and the mental health that everyone needs to be really careful about all over the world.
Do you remember when your country was put on quarantine?
Well, yes. It's, in fact, it happened in stages. Initially, there were some social distancing rules, but nothing was closed. Everything was going on as usual. People were really careful about washing their hands and so on. Schools were ongoing even after schools in the UK or in the US closed. Schools were as usual here in Singapore, but quarantine measures were extremely stringent. That means if you were in an event, hundreds of which is attended by hundreds of thousands of people, but if one person was found to be infected later, all of these people were traced. All of these people were advised to be at home and inside their home, not even to mingle with other family members in the house. But my husband was quarantined for like 2 weeks. He was and then they used to call him 3 times a day, track his mobile to make sure that he is at the designated quarantine place. The officers from the Ministry of Health came on the first day, gave him a thermometer and a few other steps. So he had to monitor his temperature 3 times a day, and and pass in.
Why did he have, were they suspicious that he was exposed to it?
He was exposed. He was in an event which was attended by an infected person.
Oh.
But he didn't catch it. That was in the beginning of March. But the contact tracing, Singapore was applauded all around the world for that contact tracing measures that the country had taken. And in fact, that is the reason why it's not spreading in the community. But then when we found, okay, everything was in the beginning of April, everything was closed, the flights and so on. And even before that, flights from certain countries were not allowed here. And that's when the schools also closed. And it was initially for 28 days. and now it's extended for another 28 days. And when it happened, I think we were the first ones to go through that uh, toilet paper crisis.
Oh, goodness.
At that-
I don't get it. Do you? What is
Uh,
the thing with the toilet paper? Every
exactly.
country that I've spoken to, except someone in Jamaica,
Yeah.
told me they've had the same reaction to the
Yeah.
toilet paper.
Toilet
And the
paper.
person that I interviewed in Jamaica told me, we just sent a shipment of toilet paper to the US. Stop laughing. I don't
Yeah.
get it.
That's true. Even when we are eating or when we are purchasing anything, whether it's toilet paper, somebody else is working somewhere else. Somebody else is risking their life, right? So it's quite commendable that even when we are locked in for our safety, some people are risking their lives. I mean, of course, we know about the frontline workers, but there's so many people, farmers and, the middleman who is in the business and so on, and they are all doing all this work, like the deliveries we get food delivery, we get groceries delivered and so on. So it's also the time to be grateful. So that's the reason I started my 30-day gratitude series. Probably that's how you found me.
Yeah.
Started with this video series of 30 day, and what I also kept in mind was, because I work in developing personal mastery, growth mindset in people, and resilience is one of the biggest things. And the reason I got into that field is because I have been working in providing innovative solutions to corporates as a management consultant. So I found that it's not because of the lack of money that a lot of innovations fail, but it's because of the mindset. Because none of those innovations start with an invention. It starts with a mindset. So if you are working in an organization, and if you think that if I try this new thing, which is anyway optional, but innovative stuff, if I fail in it, people are going to call me a failure. It's going to affect my job. It's going to affect my promotion. It's going to affect my pay raise. And that was, I'm talking about a few years ago, like 10 years ago. But now things are changing, but I wouldn't say it has changed the way it should. So that's what moved me to, the mindset as well as personal mastery and so on. So what I found in this COVID situation is that people are anxious. People are anxious about all the things that we discussed earlier. So yes, being grateful, everybody talks about being grateful, right? But what if you associate that with your resilience? What if you associate that with developing yourself? And that's what I did with that 30-day gratitude system. It's also based on one of my books. So I think that's something that we can really, really practice during this time, to be grateful about the blessings that we have, even at this point in time.
Yes, because I, in previous conversations, have shared that I have found the bright side of this. I mean, most people would say, how could you find a bright side? But I feel like I've learned a lot of things about myself during this time. And people that I've spoken with have also shared that they have found some things that they've learned from that they wouldn't have if they weren't forced into this lockdown situation. Your country extended their quarantine. So you guys have probably at the end of it would have been quarantined for 2 months.
We will finish it on the 1st of June.
Okay.
Yeah.
So how has this changed you as a person?
You will know your limits. That's one thing. I have 2 teenagers at home, and so we have a family of 4, and one is work-life balance. It's work-life balance.
Right.
It's difficult. Kids are even now, in the school that they are attending, the lessons are still ongoing. So they attend school on online every day, Monday to Friday, and they follow the timetable, and the teachers come in online and they teach them. But then they find it difficult because we are all cooped up in our own room, so we mark our territory and then this is my territory. So but the kids are basically, they are in their room, and it's frustrating for anyone. And even if it's your family members, seeing them every day, it doesn't help. And my son's, he just turned 16 during the quarantine, during the lockdown circuit breaker period, so he couldn't do much, just cut the cake at home and so on. So what I feel is, and at the same time, we are also finding our limits, right? Because however close people are, there is always something new to find about, even about our family members. Yeah. So, and that is in fact another part of resilience, right? How we can control our emotions, how we can find, what exactly is the reason why I am thinking like it, why I am getting stressed, and so on. But at the same time, it's also about understanding the fact that changes happen all the time. And for this group of kids, the kids who are, I work a lot in the education space, education reforming. That's one of the things that I do with my organization, As Many Minds. And I'm also the founder of International Youth Leadership and Innovation Forum. So I come across a lot of kids, schools, as well as teachers. And, because my big idea is to bring all stakeholders of education together, not just the kids and the teachers, but everyone involved, including the industry. And I organize this International Youth Leadership and Innovation Forum annual conferences every year. But this year, most probably it's going to be online. That summit is going to be online. But so, we do understand how, although we are talking about the technological advancements, how much incompetent that we are. We school started using Zoom and then figured out there is something wrong with the technology, the security, and so on. And the emotion, the connection, even the education is a collaborative process. So collaborations, kids were not, they knew collaboration, but they were doing mostly in physical collaboration, being next to each other, doing that collaboration, but it's affecting, right? And that social well-being, can we achieve that with technology? Of course we can, but these are things that we need to think about. Social media is not enough, but we need something more than that. And what I did in the case of my work is we had some plans. Original plans was to take some of these our products as well as trainings online. That was for the second part of the year. Initially the plan was like that, but we brought it to the first half of the year, so that we don't we can still keep the momentum, and whatever we planned for the first half of the year, we see how we achieve that in the second half of the year. So it's so the priorities have changed, but we are dynamic, we are flexible, right? We have seen it, we are seeing it.
Yeah. Well, this is so unprecedented and surreal that I don't think many of us were given time to put systems in place. So we're sort of learning as we go, at least here in the US, and it sounds like you're doing some of the same in Singapore. Mm-hmm. What would you do differently after this is, when life returns to what's going to be the new normal? What would you do different?
In terms of work, even in my organization, always we had work from home, opportunities. But one is like looking at work itself. What can we do? What can on at home? what we can't do, what are the things where we need that physical interaction with people. And I believe, since we do a lot of training and coaching, a lot of that is going to go online. Even the case of schools is one place where they were, they really, really thought that any training, any workshops need to be on site. That's going to change. So the world is going to change. And it's also about, looking at things, appreciating things, and then, realizing that, okay, these are things that could get wiped away from your, eyes at any point in time. So appreciating the little things in life, appreciating the people in our lives, and at the same time being flexible, being, there for each other. But I think that nothing is going to return back to original, the way it was, at least for the next 1 year or so, because even after all countries open up, are we going to go and like hug people and have that?
That's going to be so hard for me because I am naturally a hugger. It's innate for me. I see someone I know, the first thing I do is give them a hug. So I don't want to offend anyone. I'm going to have to work really hard on not doing that.
Yeah. So that's the thing, because until we find a vaccine or a medicine, people should be scared. People should be worried. If we are not worried, then there is something wrong. So I do see a lot of advancements in technology and interactions, and I'm also seeing how I can incorporate that in my work, in my organization. So
I think this pandemic is going to leave an indelible mark on everyone's life, and people are going to be more cautious because there is, I believe that we are going to be fighting this for a while because viruses usually mutate.
Mm.
And even though we're going to get the vaccine for this one, we don't know what's in store for the future. So I think the lesson is just to be cautious and be vigilant so you can protect yourself and other people, because we don't know what's in store next.
Exactly.
In Singapore, do you feel like the natives of Singapore are being compliant and they're staying off the streets, or do you still see people walking around as usual?
Not really. As I mentioned earlier, people are usually law-abiding citizens here, and we don't hear, unlike in some countries, we don't hear the leaders making unnecessary remarks. So
that's great.
Yeah. So people are cautious. People take it seriously because people know that it's so easy to get spread in Singapore. So yes, we don't see. I mean, of course, there are.
The reason I asked you that, because you did say this at the beginning of the interview, but in the US, you're allowed to go and walk as long as you keep your distance, like to go out for fresh air. There's no law against that. So I was wondering if you see people taking walks.
Oh, well, I mean, you can go out, however, only for necessities. Right? So it's advised that even if you want to go for a run or a walk, keep within your neighborhood. Don't venture out. If you want to get food, none of the restaurants are open, but so there are restaurants that are open, but you can't dine in. You just go collect the food and come back.
Same here.
Yeah, and you can go to only one person from the family is allowed to go out. So you can't go out as a family and have fun, right? So it's all because, it's a highly dense, population density is very high here. So think about it, like, 1,000 families decide to come out, to one place. And then, yeah. So yes, people are following the policies, following the rules, and nobody wants to get affected because it's going to cause a lot of problems for everyone. So I'm so happy that I am in this country, because I wouldn't want to be anywhere else in the world during this pandemic, because I know that I'll be taken care of well.
That's great. You have socialized medicine there, don't you?
What medicine?
Do you have socialized medicine, like medical treatment for everyone?
Well, it's not like in the US. In the US, everything works on insurance, but it's not high. I mean, especially in the case of.
You have public hospitals that are open to everyone.
Yes, we do.
Okay.
We do have.
That's
And
great.
measures are in place. There is nothing to complain about. And if you read about how Singapore is taking each and every patient who goes to the hospital for this, it's really commendable, because you need to make sure that even the hospital staff are not getting affected, so they are also well taken care of. What happened here, they have to go through a decontamination room every time you step out from a patient's room. So it's a whole process of attending every person, and at the same giving them the best treatment, but at the same time that you as a frontline worker is safe, which is great. So that's why people have confidence. People are cautious, but at the same time confident.
That's great to hear that, because I don't know if you're watching the news, but
Yes.
there's so many people in the US that think that this is a conspiracy.
Mm-hmm.
And think that we're destroying the economy. Of course, the economy is being affected, but we're not doing this to hurt the economy. But there are people who are rebelling against, the idea of being in quarantine, and they're petitioning to go back out and for different agencies to open up again. So it's great living in a disciplined nation where the people are working with the system and not against it.
Yeah. So if you compare, it's very different, because that's a thing. If you compare Singapore with a big country, the US is extremely large, and people are of different in terms of their awareness also, it's very different. So, and also many people have this wrong sense of liberty, right? Liberty is one of that core principles that you have, but many people take that word literally and say that whatever I want to do is my freedom. Right? And at the same time, the communication that goes from the leaders, that also affects, or whether it's from the leaders or from the relevant agencies, that also affects. Because if you are saying, many people have a tendency to blindly follow certain leaders, right? I mean, whoever it is. I'm not saying this leader or that leader. It's so we have to keep that in your mind, that as a leader, when I speak, there are people who don't look at anything else, but just focus on what I'm saying, and they are going to trust me. And so it's my responsibility to make sure that whatever that goes out from my mouth is of would go out responsibly, right? So yeah.
No, and I think that's very true. I think when you influence people, you have to be very careful what you're saying to them, because they're trusting what you're saying. And if they trust you, oftentimes they don't do their homework. Whatever you say, because they trust you, they take it as gospel and fly with it. So I do agree, when you have multitudes that look up to you and follow what you're saying, you have to be very careful in what you say. But we are very blessed in the United States. We have the best president in the world. I know that all the leaders try their best, but sometimes we're not in agreement with all of the policies. So unfortunately, it happens like that sometimes. And the problem with that is when someone does or says something wrong that's not accurate, everyone pays for it if they're the one making the rules.
Yeah.
So it's
It's not just about political leaders. For example, Elon Musk, he's a figure that people look up to. I know he has got his own reasons to come out and say that things should open up. We can also talk about, the immunity, the what's the word, mass immunity. Building immunity for that, it should only at least 40% of the population should get affected. But what we are not looking at, I mean, if you look at, there will be fatalities, right? So a lot of people are looking at, only this many percentage of people will die. But we are not talking about how it is going to affect several million people. They might not die because their loved ones are going to die. That will have social repercussions and so on. So coming out with better business ideas, so better business planning, I mean, that is something that political leadership and business leaderships need to look at. But ignoring the lives of people, that's not something that we should do. But people, when a person like Elon Musk is coming out and saying that, okay, we have to open up the economy, a lot more people are going to follow that, right? So I think.
Well, he builds cars, and I think I trust what the doctors who are on the forefront and the people whose focus the medical research. I think I will give more credence to what they're saying and not someone whose forte and expertise is building cars. I mean, these people are entitled to their opinions, but we have to be careful the sources of information that are coming our way and what we are going to accept. And to go do our own research as well. I try really hard not to let any of these interviews have any type of a political slant, but sometimes it's impossible because politics is such a big part of what is happening in the world, and it's affecting all of our lives. Mm-hmm. So, you have to call a spade is what I always say. And I think it's really important that you have to go and do your own research and try to agree with things that make sense and not just take someone's opinion and then have it play a big part in what can possibly affect your health and your well-being.
Right.
We're almost out of time. Can you believe it?
Oh dear.
So quickly. But this was really great. Thank you for sharing the situation in Singapore with us. Thank you for, telling us, sharing a little bit about your background. I know you didn't get to go into your books and all the other things that you do, but very quickly before we go, do you want to tell us about some of your books?
Yeah, sure. I have written many books, and many of those are resources. So one of the books, two of the books that I would like to highlight here is one is Breakthrough. And my books are mostly on mindset. Developing your mindset for your personal excellence as well as your business excellence or professional excellence. So Breakthrough was, it's based on growth mindset, but I brought together 16 other women thought leaders from around the world to write that book, to write about their breakthroughs. And what we also have is a breakthrough engine, which is a model for anyone who can, who would like to see discover their own breakthroughs. And it went on to become Amazon #1 bestseller in its category. Wow. We released it. We released at Women Economic Forum. It was really wonderful, and it's a not-for-profit book. So
that's great.
The intention was that anybody who is able to purchase it or read it, they should be able to find their breakthroughs through it. But then there are a lot of women who are underprivileged, who are in real need. So we wanted to help those people with their breakthroughs. Their breakthroughs come from financial breakthroughs, right? So we help those organizations that help underprivileged women and children with the profits from this book. So it's truly a breakthrough for everyone. The other book that I would like to talk about is Infinite Possibilities. That's again about finding your own infinite possibilities, whether it is in, whether you are a professional or entrepreneur or leader or even a student. There I look at some, I took the case study of some of those eminent figures in the history of the world. Or we all know, and looked at how they applied growth mindset in their lives at different points in their life. Whether it's when they went through some disappointments, when they failed, or when they were faced with some challenges, and so on. So that is that, and it also comes with the Infinite Possibilities manifesto, and these 11 manifestos are about how you can apply it in your life and find your infinite possibilities. And
I'm so grateful. I don't want to cut you off, but we've run out of time. But I'm glad you mentioned those books. Congratulations. So you said people can find them on Amazon?
They can, yes. It's available in ebook format as well as print book format. Yeah.
Sindu, this was great. I am truly grateful that you were able to afford the time to do this interview with me. And thank you so much for watching Conversations with Jennylyn. When a conversation is all you need to be inspired, like this conversation I just had here with Sindu, I hope you will enjoy it as much as I enjoyed doing the interview with her. Take care and stay safe.